A woman in her 20s just played video games using only her mind. No controller, no voice commands, just pure thoughts controlling the action on screen. That's not a marketing demo or a short-term stunt. She's been doing it reliably for months as part of an active clinical trial. Brain-computer interfaces, or BCI, have graduated from lab curiosity to genuine medical reality. And right now, in surgical centers across multiple countries, the trials are accelerating faster than anyone predicted. What's different about today's BCIs compared to all the failed attempts over the past 20 years? The reliability is shocking. These implants work day after day without constant recalibration. The accuracy is stunning. Patients can control cursors and robotic arms with precision that matches or exceeds a natural hand. And the regulatory momentum is real. Governments are fast-tracking approvals because the early results are this solid. But here's what makes this moment genuinely historic. The race isn't just about restoring mobility to people with paralysis anymore. That was the original mission. That's still important, but something else is happening in the labs that the headlines barely mention. The technology is getting smaller, more precise, and more capable every single month. And that's where the real story becomes something nobody fully anticipated. Brain-computer interfaces sound brand new, but researchers have been chasing this dream for over 50 years. The first real BCI experiments happened in the 1970s when scientists discovered they could measure the electrical activity of neurons, the brain's thinking cells. They proved the concept with animals. A monkey learned to move a robotic arm just by thinking about it. That was revolutionary. But translating that success to humans proved absolutely brutal. The gap between proof of concept and clinical reality was enormous. Early human trials gave disappointing results. The implants would work for a few weeks or months, then degrade. Scar tissue would form around the electrodes. The brain would reject them. Researchers kept hitting the same wall over and over. Thousands of papers were published. Billions were invested. But for decades, the tech just wasn't reliable enough to justify surgery on healthy volunteers. So what finally changed? The combination of three breakthroughs arriving at the same time. Electrode materials got better, recording software got smarter, and companies like Neuralink finally cracked the surgical technique, how to implant the device without causing inflammation that kills the signal. The pieces had to align perfectly, and now they have. That's why 1998 through 2024 felt like treading water. But now we are watching the moment everything clicks into place at once. So how does a brain-computer interface actually work? At its core, it's surprisingly elegant. Your brain thinks in electrical signals, billions of neurons firing create patterns. A BCI implant is basically a sophisticated listening device placed on your brain's surface. Tiny electrodes pick up the electrical chatter and stream it to a computer running machine learning algorithms. The algorithm learns your unique brain pattern. When you think move cursor left versus move cursor right, the system recognizes the difference and translates it into action. It's not reading your thoughts magically. It's recognizing repeatable neural patterns. Neuralink's design uses 1,000 microscopic electrodes thinner than a human hair, placed precisely in the motor cortex, the brain region that controls movement. For a paralyzed patient whose limbs won't move, those neural commands are still firing perfectly. They're just not reaching the muscles. The BCI catches those signals and routes them to a computer instead. A cursor moves, a robotic arm lifts, a video game character jumps. The connection is restored not through the spinal cord, but through silicon and code. The real trick is adaptation. The algorithm doesn't freeze after implant day. It learns how your signal changes across days and weeks. It accounts for your mood and attention level. It catches patterns happening in the background noise. This adaptive layer is why these modern BCIs actually work reliably. Early systems tried to be static. They failed. The new ones breathe with you. What can participants in these trials actually do right now? The results are staggering. One patient, paralyzed for years after a stroke, regained the ability to control a cursor and type at 15 words per minute using only thoughts. 15 words, that's not fast by normal standards, but for someone who couldn't move a finger before, it's revolutionary. Another trial participant played chess. Another played video games competitively. They weren't fumbling with adapted controls or waiting for voice commands to process. They were thinking, and it just worked. The breakthrough moment came when researchers realized the brain adapts faster than they expected. Participants didn't need weeks of training. Within days, the system felt intuitive. Within a week, they were doing complex tasks. One patient described it as remembering a limb they'd lost, not learning something new, but unlocking a skill that was always there. Just blocked, the emotional impact might matter more than the technical specs. Imagine you're paralyzed and you've accepted you'll never feed yourself again. Then one day a BCI lets you pick up a spoon, bring it to your mouth, and taste food by your own will, not through an assistant's hand. Yours. That's not just technology. That's your independence back. That's your dignity restored. And trials now include not just reaching and grasping, but eating, drinking, and grooming, things a healthy person takes for granted, but represent everything to someone who lost that ability. That's where the real power lies. Neuralink's not the only company in this race. That's actually the plot twist worth paying attention to. Synchron, a startup from Australia, takes a completely different approach. Instead of opening your skull and placing electrodes on the brain's surface, they thread a tiny stent, a mesh tube, into a blood vessel that runs alongside the motor cortex. Same neural recording, no surgery on the brain itself, lower risk. Their first patient, a paralyzed man in the United States, could control a cursor and type within days. Meanwhile, University of Utah researchers use a different electrode array called the Blackrock microarray. It's been refined over decades. Each approach has trade-offs. Neuralink's intrusive but extremely precise. Synchron's less invasive but slightly less accurate. Utah's proven over time but expensive. The international race is heating up fast. China's investing heavily. So is the European Union. South Korea has active trials. Japan's ramping up research. It's not just American companies anymore. It's a global competition. Some teams are pursuing non-invasive approaches, fancy EEG caps that read brain signals through the scalp. They are slower and noisier than implants, but they avoid surgery entirely. No one approach has won yet. The diversity of teams and methods is actually healthy. Competition drives innovation. Multiple bets hedging against any single approach failing. But here's what every research team agrees on: speed is accelerating, and the next 18 months will determine which approaches dominate the next decade. Let's zoom out. What does this actually mean for society? The immediate answer is obvious. Paralyzed and locked-in patients get their lives back. That's profound. But the implications spread much wider than disability medicine. Once you have a reliable brain-computer link, the questions start multiplying. Enhancement, amplification. What if a healthy person wants one? What if you could download skills directly, learn Mandarin in a week instead of a year? That's science fiction right now, but it's the conversation happening in research labs today. Here's what keeps neuroscientists up at night. Privacy. If your brain can send signals to a computer, could someone hack in and read your thoughts? Could an employer demand you wear one for productivity monitoring? Could a government compel it for surveillance? These aren't paranoid fantasy. They are legitimate technical questions that don't have answers yet. The trials are moving so fast that regulation is struggling to catch up. There are no international standards, no unified ethics framework. Different countries are writing different rules. Then there's inequality. BCI implants will be expensive initially. Only wealthy people and wealthy countries will have access. That creates a troubling scenario: enhanced humans and unenhanced humans. That's not just about fairness. It's about social stability. History shows us that when one group has a clear capability advantage, conflict follows. These trials are the first domino. If BCIs become mainstream, society needs to think hard about who gets them and why. And we're not doing that thinking yet. So how does someone actually get a BCI implant? The procedure itself is intense but straightforward. First comes weeks of medical screening. Brain MRI to map your exact anatomy, neuropsychological testing to establish a baseline, blood work, cardiac checks. Only then do you qualify for surgery. It's not quick and it's not casual. When surgery day arrives, you're under general anesthetic. A neurosurgeon uses image-guided surgery. They've mapped your brain down to millimeter precision using the MRI scans. They make a small opening in your skull, smaller than a bottle cap. Then comes the delicate part, placing 1,000 microscopic electrodes in exactly the right spot. Too shallow and they miss the neurons. Too deep and you damage vital tissue. It takes hours. After surgery comes rehabilitation. The implant needs time to integrate. That means your brain needs time to adjust. The inflammation from surgery subsides. Scar tissue forms in a careful, controlled way. Electrode signals stabilize. This is why early BCIs failed. They didn't wait long enough. Modern protocols give it 6 to 8 weeks before even starting training. When training begins, it's surprisingly fast. Within days, you're thinking move cursor and watching it move. Within weeks, you're doing complex tasks. Your brain learns to talk to the machine faster than anyone expected. And that's the real secret. Your brain wants to learn. It's eager to reclaim control. The technology isn't fighting your neurobiology. It's flowing with it. So here's what you should be watching right now. Brain-computer interfaces just moved from impossible to happening. This isn't theoretical anymore. People are living with these implants, using them daily, getting their independence back. The speed of progress is staggering. A breakthrough that would have taken a decade 5 years ago is now routine. The next stage is scaling. Hundreds of patients will have these implants within 18 months. Thousands within 5 years. Standards will solidify, costs will drop, techniques will improve, and somewhere along that path the conversation changes. It stops being can we help paralyzed patients and starts being should we enhance healthy humans. That question doesn't have an easy answer. It needs serious thought from ethicists, regulators, and the public. But it's coming. What matters right now is this. A generation of humans who'd resigned themselves to complete paralysis just got their future back. That's the moral core of this story. Everything else, the enhancement debates, the privacy concerns, the inequality questions, those are important. They are necessary conversations. But they are happening because a technology that was impossible is now real. And for the people using it, it's already changed everything. The headlines focus on the drama, but if you look closely, you'll see the person inside. That's where the real power of this story lies. Follow for daily AI news.